Hi, my name is Jessica, and I'm going to be talking about pre-op teaching of a patient. So I would enter the room, introduce myself to the patient. I would identify them using two identifiers. I'd wash my hands. I would ask my patient about previous surgeries that they've had, how they coped with the anesthesia, if there was any complications. I would see how my patient is able to learn, make sure they're cognitive, make sure there's no learning disabilities, and if there is, I would meet them on their level so they could understand what's going on with them. I would make sure they don't have any risk factors like sleep apnea and things like that. I would see if they have a caregiver or a parent or family member with them, make sure that the caregiver or parent is able to learn as well and understand what's going on. I would talk to my patient about what surgery they're getting, why they're getting it, make sure they understand why they're getting the surgery. I would ask them if they have any questions or concerns. I would teach my patient about things they need to do prior to surgery, like making sure they take a HIPAA bath and clean so many times and use towels, make sure that they understand about bowel emptying, if it's for like a colonoscopy or a bowel resection or anything like that. I would make sure my patient understands that they can't eat or drink after midnight depending on what surgery it is. I would let my patient know the possible medications they would have after surgery, make sure they understand the side effects of that medication and how it's supposed to help them, how it has the possibility of hurting them. I would tell my patient they're going to expect pain and how we're going to do our best to control their pain once they're out of surgery. I would teach my patient how to get into bed and out of bed after surgery to make sure they're not going to damage the incision site or anything else that happened with the surgery. I would teach my patient about deep breathing and coughing, the importance of making sure their lungs expand so they don't develop pneumonia. I would teach them controlled coughing. I would teach them diaphragmatic breathing, how to breathe, inhale through their nose and blow out with pursed lips like they're blowing a kiss. Explain how that helps with the expansion of the alveoli so that way no fluid collects in that. I would make sure my patient understands that they need to do this 3 or 4 times, and if they're watching TV, tell them to do it every time a commercial comes on to help them encourage them to use that. I would teach them how to use an incentive spirometer. Tell them to inhale and exhale all the air in their lungs, put the incentive spirometer piece in their mouth and take a deep breath, and I would gauge where the number should be on the incentive spirometer based on the patient and tell them to hold it as long as they can and slowly blow it out of their lips. Explain to them how that as well helps with prevention of pneumonia or stasis in the lungs. I would encourage my patient to do that every so often, maybe 10 times every commercial. I would teach my patient how to use a positive expiratory therapy device that it's similar to a incentive spirometer, but it is a little device. They would put it in their mouth and it helps the secretions not build up in their lungs, helps move it through their lungs so they're able to expel that. I would make sure that the caregiver understands this as well, because they're going to be at home taking care of them and they're going to be encouraging that patient to do these things. I'm going to teach my patient how to do leg exercises to help not develop a blood clot. I'm going to teach them about plantar flexion and dorsal flexion of their feet and encourage them to do that at least every 2 hours. More wouldn't hurt. Teach my patient to do circles with their heels, big circles, just to keep that blood flowing into their legs so that way no stasis of the blood vessels happens and it helps prevent a clot. I would make sure that the caregiver understands this information and I would make sure that they don't have any concerns or anxiety, and if they do have concerns or anxiety, help address that with the patient. Teach them coping mechanisms and anxiety mechanisms. I would make sure my patient understands that the realistic measures of the surgery. Make sure they don't have unexpected beliefs of what's going to happen with the surgery. I want to make sure that the team understands the patient's anxiety, emotional stance on it, any risk factors, things like that. I would make sure I document all this teaching into the patient's medical record, so that way there's proof that I did it. Then I would, whenever I leave my patient, I would make sure the bed is in the lowest position, the upper half of the side rails are up, make sure my patient has the call light and their bedside table and water and everything like that within reach to prevent any falls. And I would tell my patient if they need anything to be sure to reach out to me, and I will be back within an hour to do my hourly visit. Thank you.